And we're live, y'all. So the coronavirus over the last 2 to 3 months has literally consumed our entire lives. It's affected the way we work and interact with our friends and family. Now all over the United States, the economies are slowly starting to open up. But during that time, what effect has coronavirus and social distancing had on us, our physical well-being, and our mental health? Today, we're doing a Facebook Live Q&A to discuss what is life after COVID-19. What's up, San Antonio and world? I'm Dr. Qasim Butt, and I'm a kidney doctor. And I'm here to break down health in a simple way. Now do me a favor, hit up that like and share button. It'll really help me out. Now today is an awesome episode because it's the Facebook Live Q&A. So please feel free throughout it to leave questions and comments during the whole thing. And just so you know, at this point, I am completely sick of hearing about COVID-19 and coronavirus. So I thought I would kind of change it up a little bit. All right, we're going to change it up. We're going to talk about how the coronavirus and COVID-19 has affected us and changed our lives. And today we have a special guest with me. It's Dr. Samir Islam. He's actually a gastroenterologist, a really good friend of mine. He's actually a pinch hitter for me right now because I had someone else scheduled to come on, Dr. Chris Ramdeen, but he had other engagements to go to. So thank you, Samir, for coming in. And why don't you go ahead and introduce yourself, please?
Well, Qasim, thank you for having me on. Yes, I'm a GI doctor. That means I'm an actual poop doctor. I go pretty much where all your food goes. I've known Dr. Butt for pretty much my whole life. We grew up together, and I love what he's doing with his channel. I think what he's doing is not only helpful for his patients, but also for my patients as well. I have a lot of patients who have a lot of kidney disease, and Qasim, thank you so much for allowing me to be on your channel today.
Oh, appreciate that, man. And you know, honestly, man, I kind of not copied you, but I saw what you were doing, and then I was like, man, this is pretty cool. And if you could do it, I'm just like,
It's very true, actually. If I can do it, literally anyone can do it.
But no, what was cool, man, is, you know, I was thinking about it today. We've known each other for over 25 years. Like almost over 25 years, which is crazy. Like I don't think I'm that old, but
yeah, I know. It's actually, I was thinking about this too because, you know, with the Jordan documentary going on.
I was thinking about that. Go ahead.
Yeah, exactly. You're right. So I don't know if you guys know the story. I'm sure you don't, but me and Qasim actually, for the first time we met was on one of the NBA Finals games when Jordan was playing, and actually I was reminiscing about that when I was watching the Jordan documentary. The first time we met,
it was at your house.
Together for the love of basketball and Jordan.
Yes. And Paxton for three.
Yes. That's exactly right.
That was it. Anyway, man. So this is crazy. You know, this has been like such a crazy time for all of us in the medical community, but even just in general for everybody. You know, it goes beyond just a virus and the illness it causes. This has really been like a strain on our society and our economy. You know, and just so y'all know, I have the cases here. At this point, we're looking in Bexar County here in San Antonio. We're talking about 2,500 cases, about 70 deaths. In Texas, we have about 54,000 cases, 1,500 deaths. United States, 1.7 million and over 100,000 dead. And worldwide, we're at almost 6 million with 358,000 people passed away from it. So, you know, we're dealing with a terrible disease, but this is having such a horrible effect on our society. But I think it's going to have some positive effects too. But as far as how you practice medicine, man, like how are you thinking this? How does this change the way you practice medicine?
Well, I think one of the things that I've noticed is that the advent of telemedicine, which I think has been a game changer for not only our practice, but practices across the U.S. So before all this happened, it was very difficult for us to get approval from Medicare and other insurances to do telemedicine. Now, with the advent of telemedicine and with the emphasis on social distancing, it is so much easier for my patients and frankly safer for them to either call me or do a video conference where I can actually talk about their health and not have to have that necessary interaction in the clinic, which, you know, if you leave the house, sometimes you can be exposed to different viruses or illnesses. So I think telemedicine by far has been if there could be any good from this, this may be some good, this new change in terms of how we're dealing with our patients.
Yeah. And guys, anybody out there who is a patient has had experience with telemedicine, please let us know in the comment section what y'all think about it. I really want to know from the patient side because I've gotten pretty good feedback from it. And you know, other thing, Samir, you know, it was pretty amazing how quickly insurance companies and Medicare changed their payment models to accept telemedicine just all of a sudden, and you're wondering why didn't they do this before? But
You're exactly right.
yeah,
Before it was such a pain
yeah,
to get any insurance companies to just approve what is the next logical step. I mean, we do Skype, we do Zoom, we have meetings, we have FaceTime. This has been around for a long time. It's not like this technology is new,
yeah.
but it just took, unfortunately, a crisis for the insurance companies to actually approve this to allow us to take care of our patients more effectively and also more importantly, more safely.
Yeah, absolutely. And even with me, like, I like to see my patients up close, especially with people who have swelling and shortness of breath issues, like to actually do a physical exam. But I want to say 70-80% of my patients can get away with doing a televisit for the most part for like a quick follow up. Just me putting an eye on them just to make sure. And so I think this is going to be a game changer for them especially, and like those relatively healthy person, do they really need to physically see the doctor,
Yeah,
but
that's
no.
exactly right. I would say, for at least in my clinic, as a poop doctor, it is important for me to sometimes, put my hands on a patient, feel where their pain is at. But if they're coming in for a follow-up, they have reflux, or they're having some diarrhea, or they're coming back from their colonoscopy, they want to know the results. That's an easy visit we can just do on the phone or via telehealth.
Absolutely, absolutely, yeah. And you even notice in meetings too now, like a lot of like meetings that I used to travel 30 minutes to for a company or for like a foundation or something that I'm going to. Now I just do it in my office from my office. Like it was crazy to me the other day, but I had a meeting in my office. I was literally in my office in downtown San Antonio. I had my clinic. I was able to round on my dialysis patients in a dialysis unit on my phone. Then I had a clinic in Boerne, Texas, which is like 40 minutes north of downtown Dallas, downtown San Antonio. And I was in my office. So from 8 to 5, I was able to accomplish so much without that extra travel time, you know?
Oh yeah. I gotta tell you something, and this is a secret, so I maybe should not put this out there on Facebook, but
Yeah.
sometimes during these Zoom meetings when I have there, I'll turn off the video and I'll work out. So I'll do like double the things that I'm supposed to be doing. So in my meeting, I'm doing, some heavy squats, some heavy deadlifts, and
Yeah.
then the minute they need my opinion, I'll just pause, catch my breath, turn on the video. Hey guys, yeah, so let me go and comment about this, and then turn off the video. So I
Yeah.
probably said that on Facebook, but it's okay. I think most people are doing that.
Yeah, yeah, and honestly, I have basketball shorts on right now, so it's totally
Yeah.
cool, like,
Right.
but I really do. But
Right.
so, but I've noticed that, again, like the way we practice medicine, I think it's going to evolve. I think it's going to be actually better, and
Yeah.
I think it's going to be like, okay, there's not even talking to people that are in close proximity, but you're in Lubbock, Texas, right? So you are a gastroenterologist, you're in Lubbock, Texas, and so and even in San Antonio, we have these peripheral cities that are 20, 30, 40, 100 miles away. And these people don't necessarily want to drive, or can't afford to drive, or are old and have difficulty doing it.
Absolutely.
So this is going to be a game changer for them.
Oh, absolutely. Yeah. So I'm sure it is in your clinic, in San Antonio area, and like you mentioned before, but the city of Lubbock is about 250,000 people, but the medical community it serves is about 3 million. So it's pretty much all of eastern New Mexico, all of West Texas, Odessa, Midland, Amarillo,
Yeah.
Abilene, and those it is far to drive to all those places. You're exactly right. It's just as opposed to taking that 2 hour drive to come see me and then taking that 2 hour drive back, that's 4 hours out of your day you have to spend just driving when you can just pick up the phone and then boom, we're
Yeah.
there.
Can I ask you something though? Like, what is the drawback to it from your perspective? Because I
Yeah.
feel like there is some drawbacks to it, but what do you think is a drawback to doing the telemedicine visits?
Absolutely. So I think one of the things that I've noticed, and I find this very important in medicine, is that there is therapy in actual physical touch of patients. I mean, there
Totally
really
agree.
is. So
Totally agree. Yeah.
absolutely. So you have somebody who's at your most vulnerable, who's talking to you. They're opening themselves up, whether it's their issues with their kidneys, hypertension, for me, gut issues. These are issues they don't talk to everybody else about. So they're opening themselves up to you. And there is, I think, actual therapy and having a one-to-one conversation with
I
somebody,
totally agree.
taking their hand, kind of letting them know what's going on, feeling their belly. I've had a lot of patients tell me who've seen a lot of other doctors who tell me when they see me in the office, this is the first time a physician's actually done a physical exam on me. And that blows my mind away. So that's
Absolutely. Yeah.
exactly right.
And sometimes like we have to have those bad talks.
Yeah.
I have to start someone on dialysis, or hey, you may be passing away, and to do it over this is a little like insensitive or kind of distant.
Right.
So being able to hug somebody and shake their hands, like I think that makes a difference. So I don't want it to replace medicine. I don't think it can replace medicine, but as a supplement to medicine, I think it's an excellent thing. I think for sure. Now as far as that, like other than that, other innovations you see coming out of this? Do you feel like there's other innovations coming out of this besides that? I mean, I think that's the big one. But
I think one of the things that I have seen, and I'm hopeful this will be an important change to occur, is how rapid research is going in terms of diseases that people have. So, obviously COVID-19 really began in, April, March, kind of around that time. And
Mhm.
from then up until now, we've had so many different clinical trials, so many different studies, so many different vaccine trials, lab tests. I mean, this has been such a rapid turnaround for some of these tests that in the past would take months or even years. So I'm hoping that momentum to get quicker studies done, effective studies done, and not having the bureaucracy of trying to go through multiple hoops, I'm hoping that will be limited as well.
Absolutely, absolutely. I mean, and so again, I think there's a silver lining to all of this. Again, I think we're going to go through some suffering first, but afterwards, we'll hopefully come out better from this. Now, the other
Yeah.
thing, like, what I've really noticed is, there's really, the social distancing is needed, of course, because, prevent the spread of the virus. But social distancing itself can induce some problems, especially our physical well-being and some mental health issues. And what's some of that kind of stuff you picked up on?
Yeah. So what I stress to my patients is that there is a difference between social distancing and social isolation. Completely different things. So
Yeah.
social distancing, obviously, you want to protect yourself, protect others, stay 6 feet away. Don't go around people you don't need to be around. Don't go out if you don't need to. But don't isolate yourself because there's so many medical problems you can have with just isolating yourself, depression, just feeling bad, just all sorts of things that are not good for your health. And so I stress to my patients, go out, go for a walk. It is beautiful. At least in Lubbock, it is really pretty outside right now. Go
Mhm.
for a walk. Go exercise. If you need to go out, go out, but stay 6 feet away. Use Skype. Use Zoom. You have FaceTime. Find ways to communicate.
Well, one positive lining of the whole social distancing, like, I'm actually spending more time with my family,
Yeah,
and you actually like it. It's
yeah,
almost like it's weird in this new age now, especially with kids, and I think it's the neurotic parenting that we have now. But you always feel like you have to entertain your kids,
yeah,
right? Take them places, do this, do that. But you start to realize just spending time with them at home on the couch, or just going. My daughters learn how to ride bicycles during this
yeah,
time. So the subtle things that we grew up with that we appreciated, you start to appreciate more
yeah,
without, by negating a lot of the more modern stuff. You see what I'm saying? And that kind of
yeah,
stuff. Yeah. And so I think that there is a positive to that. But what's ironic to me is like, like ironic is like, because one thing you didn't know about Dr. Islam here, what I like about him a lot is that he's not just a doctor that is about the next medication and then the next medication. He realizes the most important thing is lifestyle, right?
yeah,
Lifestyle change is the big change
yeah,
that really can affect you and improve your quality of life. And I always tell my patients, losing weight, losing 10 pounds is probably more you can do for yourself than any medication I could ever add to you. And
yeah,
so, what's ironic is when we're doing the social distancing and everyone's staying at home, they are living more sedentary lifestyles. And so that's the ironic part. But
yeah. You're exactly right. And that's one of the unfortunate things about, the about staying at home is that, we're not doing the things that we normally do. We don't go to the gym. We don't go out, and also it's we just don't eat good. We're
oh,
either takeout, ordering food in. I mean, I don't know if you had the same issue, Costin, but in our house, our we're eating. My kids are excited because they get to eat out more and more and more as opposed to what we did. We didn't do that before.
yeah, yeah, yeah. I think it's the little things here and there that really I've started to appreciate. But the
Yeah.
thing is, there is, I know there was a talk we were talking about like social distancing. There is a component that we are socially disconnected now because I actually miss hugging my patients or
Yeah.
shaking a person's hand
Yeah.
or just hanging out. You know, so I think this is going to have a psychological effect on a lot of people, especially those that were kind of lonely to begin with.
Yeah.
And so I wonder how they're going to cope with it. Because I myself, I think I felt like some baseline, not depression, but a downness,
Yeah.
with this whole thing going on.
So you actually bring a very good point because 2 days ago I felt like this. I was like, man, this is really feels like Groundhog Day. I feel like I'm circling kind of over and over again. So I put a post on my Instagram, and I actually made an effort. So normally I wear suits to work. I actually like
Oh, yeah,
looking
the bow
pretty.
tie. I
Yeah,
saw
my
it.
bow
Yes, sir.
tie. I was like,
Yeah.
forget this, man. Forget COVID. I'm going to dress up today. I'm going to go in my normal kind of work clothes and just do my work. I'm going to wear a mask, and obviously, I'm going to still be 6 feet away from my patients and protect myself. But I decided, hey, I'm going to go ahead and just dress my normal clothes. I felt so much better doing that.
I agree. I agree, and like, cause I'm in scrub heaven or hell right now.
Yeah,
I'm wearing it every day, coming home, shaking showers, and I miss dressing up.
yeah,
And I think there's a joke out there like the COVID-15, right?
yeah,
Like you're,
yeah.
and I think I put on like 5 pounds just because of lack of activity. Lack of going outside as much, and so
Absolutely.
it's a weird it's a weird scenario here.
Yeah.
Let's see here. Let me just see what some commentaries people have said. Fallon Tari says it's nice to see families playing outside together. It is. I've noticed. You probably noticed this in your neighborhood too, man. Like people are outside on the bikes. My daughters learn how to ride bikes, but
Yeah.
it's nice to see that kind of interaction again. Prem Thrip, she's out there. Only one place I really miss is reading Starbucks. But that's the thing I love. No one tries to hug me. Okay, like, but yeah, no, I actually miss going to the coffee shop. I really do. I do go to the coffee shop like just to pick up a coffee, but I
Yeah.
do like I actually take my daughters or just go and hang out there sometimes, do my reading in a coffee shop. You do miss that kind of engagement there.
Yeah.
But yeah, man, it's a crazy scenario. What else do you see coming out of this, man? Like any other observations you see a change in psyche, like not even change in psyche, but a change in the way we do things in America? Do you find that there's going to be anything like that?
Yeah, so I'll tell you. I'll tell you one thing that I'm worried about. And I've been thinking about this for a while. Is that I don't want people to be so scared that they don't get their normal health checkup done.
Yeah.
Um, what I've seen is that I've seen patients coming to see me, which is great. I'm happy about that. But sometimes my patients may have a decision. Hey, I have this. I need to go see my doctor, but I'm worried about whether I'm going to get sick by doing that. I'll just forget seeing my doctor and just wait a couple more months or a couple more years. And what I'm worried about is that the things that we normally can take care of or be preemptive about, whether it's lifestyle changes or checking their hemoglobin A1C or checking their lipid panel or me doing a colonoscopy on them, those things are people may be making the decision to put that on the back burner, but by doing that, they actually may be harming their health. I'm really worried about that.
Oh, that's true too. Yeah, I mean, like, you see people are just kind of scared
Yeah,
to even go out. Depend. I think it's kind of an extreme. There's some people right now don't care and just go out. There's some that like literally are paranoid and
yeah,
they've been scared to death and they want to stay home. Like I've had one of my patients didn't want to go get a kid evaluated for a kidney transplant because
yeah.
she was too scared. And so, there's certain things you want them to do, but it's that weird balance, right? How much fear do you instill in society to get them to do something, like,
Exactly right.
and not have that detrimental adverse effect. But
Yeah.
the economies are kind of opening up now at this point. So, and I'm wondering, everyone out there, what do y'all think about the economies opening up? How do y'all think? That's affecting everything, and how do y'all like it? Do you like to see the economy opening up? Do you guys? What about you, Samir? How are you feeling about it?
It's man, it's such a hard question to ask or answer
Yeah.
because I can completely see both sides. The concerns that people have about their business and the concerns about the economy not being so good. But at the same time, I understand from the medical standpoint the risks that are entailed with opening up the economy. I don't know. It is a hard decision. I am so thankful that I do not have to make that decision myself.
Yeah, no, and this is the weird thing. I think especially with social media, I know it's funny because we're on social media, but like people are very judgmental, and
Yeah,
so, and I'm not trying to criticize the president, the mayor, the governor, or whoever, WHO, CDC, but this is literally like day by day calls. Like
yeah,
everything that we're doing right now, we're flying at the seat of our pants because we never experienced something like this.
yeah,
So, I would hate to make that decision because it's like, do you let a virus take over and have a pandemic in your city,
yeah.
or do you let your economy crash? And that's what they're dealing with. And
Yeah.
so you have to understand from either perspective that no one's trying to hurt you or trying to, tell you what to do, but they're trying to come up with some sort of solution. What's the happy balance?
Right.
And
Yeah.
so at this point, I'm wondering, I'm actually, I think at some point we got to come out of our huts, right? So we're coming out. We'll see how it goes and go from there. Brittany Do, hi Brittany. So he actually asked me dialysis patients and kidney patients. What are some fitness to do at home? That's a good question. So I'll be honest with you. I would start with just walking. Okay, so if we're just talking about kidney patients and dialysis patients, the biggest killer, I think one of the biggest killers is sedentary lifestyle in America. And so, especially with our dialysis community, that especially if they're not employed or something, they're just sitting at home. So I would simply start with just going out for a walk, especially here in San Antonio where it's nice.
Yeah.
Going out for a walk. There are exercises, but again, it's patient specific, right? I don't want to tell you to do like he talked about doing squats. I'm not going to tell you as an 80-year-old woman with hip problems to do squats. But if you're a 40-year-old on dialysis, maybe you should do some squats. But start simple. I would say start with that. Do you have any recommendations for exercises you think people? I know you're a big exerciser. I know you used to do what is it, CrossFit and stuff,
CrossFit.
right,
Yeah.
man?
Yeah.
So,
Yeah.
but tell them anything you recommend to your patients.
Yeah, I think something as simple, honestly, is going for a walk. Pretty much anyone can do that, and there's so much benefit for just walking, being outside, and just doing that. And little simple things you can do, push-ups, sit-ups. If you can do, air squats, you can do those. These are simple things anyone can do at home. You don't need special equipment. It's just something to kind of keep you active. Also, if you want, just play with your kids. If you have kids, play with them outside. I can tell you, when you run around with your kids, that is just as hard as a CrossFit workout.
Yeah, no, yeah, you're right. It does get involved. And
Yeah.
we recently got a bicycle. I started bicycle. I hadn't biked in like 20 years, man, literally.
Yeah.
And so, yeah. But no, I agree. And it is weird. In the sick community, not sick community, but the patients that are sick, it's almost like a lot of doctors in our community, like almost put like a negative spin to exercise. Like, don't exercise. It's dangerous. You get approval from your cardiologist, like
Yeah.
all this stuff. And I'm like, just simple stuff like so,
Yeah.
some people are actually scared to exercise, and amongst our communities. So let's see here. Fallon Tari, any tricks on communication with those who are hard of hearing while wearing a mask? They don't have the benefit of reading lips. The patients are getting a bit frustrated. That's actually a good point. Reading lips, like that's actually good. Point. I don't know what it is, to be honest with you. With people that are hard of hearing, every once in a while, if I'm at distance, I kind of put it down here if they are. But other than that, I don't know what else you could do.
Yeah, it's hard. I honestly just have to end up yelling at them for the
Yeah.
kids to hear.
Oh, and flying. Someone's asking Sarah Farah Shadber. She's asking about flying at this point. Flying with her 1 year old grandson. Please respond to me or drive from Ohio to California. Wow. I can't make that call right now. I think it depends on what area you're in. What I've heard though, a lot of airports are empty at this point, right? Have you heard that, Samir?
I've heard that too. Yeah.
Yeah, yeah. And Anna Crosco, I'm glad everything's opening up. I'm still being very careful because I have lupus. So Anne here, she's a lupus patient. So clearly she's in that special category. And I think people need to know that. Like, certain people are at higher risk for COVID. So if me and Dr. Islam, relatively healthy, 40-year-old males, got it, we'd probably survive, do pretty well. But someone like Anne here, who's got, lupus, she's at risk because she's on immunosuppressive medications. And
Yeah.
so if she gets the virus, she may not have the ability to fight the infection. And that's what we're talking about. So,
Right. Exactly right.
yeah. My dad's on here too, Samir.
Oh,
Hi, Dad. What is the use of wearing masks when others don't? My mom protect others. There's a twofold benefit there, Dad. So one is you're not spreading it to other people and not getting it back to you, but the protection goes up if they're not wearing it. If they're wearing it as well. So if they're not wearing it, it's less protective of you. But there is some protection there inherently.
yeah.
Um, some people. Let's
I think
see.
Brittany had a good question, Costum. She said, "Do you suggest people and kidney patients to go to fitness gyms, and how should we prepare?" What do you think about that?
Again, I think it's patient specific.
Yeah.
I don't think a elliptical trainer is going to kill anybody.
Yeah.
But I really encourage my patients to exercise. Like of course if they have severe coronary disease and stuff like that, get approved from cardiologists. But going to a gym right now.
Actually
Ooh,
going to a
that's what you're
physical gym.
talking
Yeah.
about. Ooh, I don't know. because
I don't know.
I would definitely put the kidney patient population. If you're CKD 3, 4, 4 especially, and if you're on dialysis for sure, you're at that high risk.
Yeah,
And a fitness center is going to be people contained together, and a lot of those people are going to be young and healthy, and
yeah.
so or relatively healthy. And they're going to be asymptomatic carriers. So there is a danger there. So if you're a dialysis patient, kidney patient, I definitely think you should try to do stuff at home. By the way, guys, there's so many resources online right now, like YouTube, fitness videos meant for different age demographics, different, male, female, whatever. So there's a lot of resources out there. If you just start Googling it, not even Googling it, YouTubing some videos, you can find something simple to do with a lightweight that may just be beneficial just to get the heart rate up a little bit. Steve Moreno. Steve Moreno used to be a tech of ours, but it's good that the economy has been jump started. But I feel like the people should be more aware of how to properly use PPE. That is a good point, right? There's a lot of people don't know how to use PPE, right,
Yeah,
Samir?
that's so true. Oh man, that's great. So my wife's an ICU doctor. That's one of her biggest pet peeves is that she every time she sees somebody outside not wearing the PPE correctly, she goes nuts.
Oh, is that right? Yeah,
Yeah,
yeah. And but what's weird? I think in the medical community, I'm not. Again, this is where I think we had to play it by ear. But we sent out some mixed messages, right? We initially said don't wear masks,
yeah,
and so we told people, hey, don't wear masks. Everything will be okay. Just the people that are sick or you're taking care of someone that's sick, or they should be wearing masks. And I think that sent a mixed message out there to people. And so I think they don't know what to do. And when we're in the medical community, we know about sterile technique. We know about all the things to keep ourselves clean. But generally, people don't. They don't understand what sterile is, what non-sterile. So touching here, touching your nose, they don't consider that dirty. You see what I'm
right.
saying?
Yeah,
So
exactly.
yeah. Brittany, do you suggest people and kidney patients? Oh, that was the one, the fitness gym, right?
Yeah.
It's pros and cons about reopening. Oh, Prem here. It's pros and cons about reopening businesses, but for my views, why can't we wait a couple more months? But I do believe USA made the best decision for the majority of people. That's a good point. You know, I don't know if you can close the the largest economy in the world for 3, 4, 5 months. I don't know if that's possible. That's the thing. It's a very difficult decision. And then you start 33 million people file for unemployment, food lines places. It gets scary, and people understand. I think, we talked about this on, financial literacy and stuff. But like if you don't have cash flow, you're not
Yeah.
paying debts, you're not paying mortgages. You can't put a pause to all that, and
Yeah.
so it becomes very, very, very difficult.
Yeah.
And so I'm not on the camp of saying everyone go back to work right away, but I think we have to be sensitive to that as well.
Absolutely.
Let's see here. I'm going to maintain social distancing. Let's see here. My beautiful mother has dementia. ML Flores Garcia, having so much difficulty with communication and trying to make mom understand. I can't kiss her, show affection to her. Affection. It's become very difficult, doctor. Please need guidance.
Yeah.
Honestly, ML Flores, I had the same problem. When this first started, Samir, like, I wasn't kissing my daughter for the first few days, like when I came
Yeah.
home. I didn't know what to do. So I come home and I wasn't, my daughter, you have girls. Oh, yeah,
Yeah.
well, you're the second interview I've done with all girls. So he's got
Oh,
four
sorry.
girls. So my girls, when I come home, run to me, want to kiss me. And I was telling them no. And
Yeah.
it's a weird thing. And I totally understand you, Ms. Garcia, but and I feel for you, but it depends on what you do for a living too. I mean, if you're not highly exposed to people, it may be okay to show affection. But I see where your apprehension is at this point.
Yeah. Absolutely.
So anyway, Samir, well, hey man, this has been great.
Yeah.
I kind of didn't want to do COVID over COVID. I just wanted to see what we were thinking and everything. And I really appreciate you substituting in like this, man.
Oh, of course. Anytime.
So,
Anytime, man.
and guys out there, please follow Samir. His handle's up there at Samir Islam MD. You're on Facebook, YouTube. What else? Instagram.
TikTok. Oh man, I'm doing some crazy TikTok stuff. That is a young man's game, that's for sure.
TikTok is weird. I'll be honest.
Yeah. Yeah, actually, as soon as I'm done with this call, I have my own Facebook Live coming up in about 30 minutes also.
Yeah, so if you guys want to check him out, please check him out on his own Facebook Live. And again, guys, thanks for the comments. Please like and share as much as you can, and we'll go from there. And guys, remember, it's your kidneys, your health.